I want you to imagine that you have a 16-year-old transgender client who is ready to make the transition from male to female after years of experiencing gender dysphoria. This means he is feeling uncomfortable about his assigned sex at birth compared to his gender identity. For several years, he has underwent counseling and assessments with a mental health provider who focuses on working with transgender individuals. He has his parents' consent and a diagnosis code that was established by the American Psychiatric Association that was created to help people with gender dysphoria get access to necessary health care and effective treatment. But due to loopholes, his insurance does not cover the cost of his expensive hormone therapy. You got it? Okay. So today I want to talk to you about an important topic that is essential for us as healthcare providers: ethical considerations of gender identity and sexuality. As healthcare providers, we have a responsibility to provide compassionate, respectful, and inclusive care to all individuals, regardless of their gender identity or sexual orientation. This means being aware of and sensitive to the exceptional needs and experiences of our patients and colleagues. First, let's talk about an important resource that can guide us in providing ethical care to our transgender and gender nonconforming patients: the World Professional Association of Transgender Health, or in shorter terms, WPATH, Code of Ethics. The WPATH Code of Ethics provides guidelines for healthcare providers working with transgender and gender nonconforming individuals. Nonconforming are those that don't conform with the gender norms that are expected of them. This code emphasizes the importance of treating patients with respect and dignity, providing informed consent, protecting patients' privacy, and ongoing education and training. By following these principles outlined in this code, we can ensure that we are providing ethical, patient-centered care that is respectful, affirming, and supportive to our transgender and gender nonconforming patients. One of the most important considerations is respect for autonomy. All individuals have the right to self-determination and to make choices about their own gender identity and sexual orientation. As healthcare providers, we must respect our patients' autonomy and ensure that their care is patient-centered and fitted to the individual's needs. Another critical ethical consideration is non-discrimination. We must not discriminate against our patients or colleagues based on their gender identity and sexual orientation. This includes providing equal access to care and creating an environment that is welcoming and inclusive for all patients. An example that could be used for this is gender-neutral bathrooms and a doctor's office. Confidentiality is also an essential ethical consideration, especially for those who are part of the disregarded community. We must protect the privacy and confidentiality of our patients, including respecting their chosen name and pronouns, and ensuring that sensitive information is only shared on a need-to-know basis. Informed consent is another critical element of ethical care, particularly when it comes to gender-affirming healthcare. We must ensure that our patients have a clear understanding of the risks and benefits of any procedure or treatment, and that they are able to make informed decisions about their own care. Finally, we must maintain professional boundaries with our patients and colleagues at all times. This means refraining from any behavior or language that is discriminatory, harassing, and unequal. Now, let's talk about how the WPATH Code of Ethics can guide us in providing ethical care. The PATH Code of Ethics provide guidance on ethical conduct for healthcare professionals. For example, the principle of beneficence reminds us to act in the best interest of our patients and promote their well-being. The principle of justice reminds us to treat all patients fairly and provide equal access to care, while the principle of respect for autonomy reminds us to respect our patients' right to self-determination and ensure that their care is patient-centered. In conclusion, by following these ethical considerations and principles, we can ensure that we are providing compassionate and competent care to all individuals, regardless of their gender identity. We have a responsibility to be aware of and sensitive to the unique needs and experiences of our patients and colleagues, and to provide care that is respectful, inclusive, and ethical. Remember your 16-year-old client? Okay. Taking into consideration of the WPATH Code of Ethics, what would your plan be to ensure your client had their necessary treatment while abiding by the legal and ethical laws? I'll give you a moment. Are you ready? Let's go through it together. We, as a professional, should work with the client and his family to investigate all available options for covering the additional cost of his hormone therapy and seek alternative insurance coverages or some form of financial aid. While doing so, we should be advocating for his rights and his access to appropriate medical treatment, including the required therapy, as part of his gender dysphoria treatment plan. We should also be encouraging the doctor and the insurance company to seek further education while informing them on the medical necessity of hormone therapy for individuals with gender dysphoria, such as our client, and promote coverage of their treatment. Equally, if not most importantly, we should maintain the confidentiality of our client, which is the 16-year-old, and respect his gender identity and appearance throughout his treatment process. I hope this presentation will benefit you in your future endeavors when it comes to those individuals that are needing the help they need in order to feel positive and protected in their chosen body. Thank you.